Senate Bill 1376 mandates that schools and districts across the state of Arizona include mental health instruction to existing health curriculum in partnership with the Arizona Department of Health Services. Teachers and professionals want to make sure it's making the grade. The bill passed the state Senate and it is currently waiting for a vote in the state House. Senator Bowie expects the bill should pass on a bipartisan vote. Doses of COVID-19 vaccines are being administered quickly, but some people are hesitant to receive one. Health experts are trying to change that. According to the Arizona Department of Health Services vaccine dashboard, only 15% of COVID-19 vaccines have been administered to people of color. 35% of vaccine doses administered are categorized as unknown or another race. In the broadcast center, Mitchell Zimmermann, Cronkite News. According to National Nurses United, Filipino nurses are much more likely to contract COVID-19 and die from the virus than any other minority nursing group. Jennifer Samara is a Filipino registered nurse for a medical surgical unit at a hospital in the Valley.
I was floated one time in a COVID floor wherein we don't know where to get the yellow gown anymore.
She's talking about the extra gowns nurses wear when treating patients with COVID-19.
My husband and I are both nurses, so there is higher risk whenever we come home.
According to National Nurses United, Filipino nurses make up 30.1% of all COVID-related deaths. This number is significantly higher than the amount of Filipino nurses in the workforce, which stands at 4%. Arlinda Singaraja, the president of the Philippine Nurses Association of Arizona, says she knows several nurses that have contracted COVID-19. For her, it's become personal.
We're all spread out throughout the different hospitals. So when one nurse is affected with COVID, we are all affected.
A small gathering, just the family. But then suddenly we got symptoms.
Overall, nurses of color make up over half of the COVID-related deaths compared to just comprising 24.1% of the workforce. Singaraja delivered food to Samara while her family was recovering from COVID-19.
Always asking if there's something that I need or my family. She's so amazing.
Singaraja has created an anonymous email to help those in need.
And you could send me an email, whether you wanted prayers, you wanted help with grocery shopping.
Both Singaraja and Samara have given back to the community since March. Samara has made over 1,700 masks.
The surgical cap for since the beginning of the COVID, and I do it for free.